Today we're here to talk about a common problem that affects millions of people, arthritis of the base of the thumb. The goal of this video is to help you learn to recognize this common ailment, make the diagnosis, and offer guidance for your patients. Also known as CMC arthritis or basilar thumb arthritis, arthritis of the base of the thumb involves the joint between one of the small carpal bones of the wrist, the trapezium, and the thumb metacarpal. This trapezium is shaped like a horse's saddle. This allows for lots of motion at the base of the thumb, but it also predisposes this joint to developing arthritis. When we pinch with our thumb to our fingers, 12 times the force of that pinch is transmitted to the thumb CMC joint.
Arthritis of the thumb CMC joint is typically osteoarthritis, not associated with any systemic illness or disease. Osteoarthritis refers to the loss of articular cartilage or gliding surface of the joint. Here's an example of how normal articular cartilage looks arthroscopically. Here is a joint with osteoarthritis. You can see that there is fraying and fibrillation of the cartilage. Patients with thumb CMC arthritis may or may not have osteoarthritis of other joints in their body. Sometimes patients also have arthritis of the small distal interphalangeal joints of the fingers. However, unlike rheumatoid arthritis, there are not other signs or symptoms of systemic disease. Thumb CMC arthritis typically becomes symptomatic in patients 50 years old and older, and is much more common in women than men. Somewhere between 20 and 40% of women may develop thumb CMC arthritis during their lifetimes. The most common complaint is pain on the thumb side of the wrist. This can make it difficult for patients to open jars, turn keys, or turn doorknobs with the hand. Pain often waxes and wanes and is typically worse with activity. Patients may also complain of stiffness or swelling of the thumb.
My left hand was really almost immobile. I was just so tired of all the pain, and I had very little strength in my thumb, and so I just started adapting to using my other hand for more things. It was really a very uncomfortable situation. I learned to do more things with my right hand. I was at the computer. I was working at that time. And even just answering the phone, grabbing the receiver of the phone was something that I would always do with my dominant hand. And there I was really almost unable to do that.
Patients sometimes confuse thumb CMC arthritis with carpal tunnel syndrome. They may come to your office reporting that they think they have carpal tunnel syndrome. Although patients with carpal tunnel syndrome often report some pain, the hallmark of carpal tunnel syndrome is numbness and paresthesias in the hand. Patients can have both carpal tunnel syndrome and thumb CMC arthritis. In fact, up to 40% of patients who have surgery for thumb CMC arthritis also have carpal tunnel syndrome. When you examine the hand of someone with thumb CMC arthritis, palpation over the thumb CMC joint, located beneath the muscles of the thenar eminence, will reproduce their pain. In some patients, applying axial load to the thumb while rotating the thumb can cause pain. This is known as the grind test. Long-standing thumb CMC arthritis may have more obvious changes to their hand. They may have bony enlargement of the base of the thumb, which is due to gradual subluxation of the joint combined with bone spur formation. They may also have a contracture of their thumb web space, such that it's difficult for them to draw their thumb away from the hand. Plain x-rays of the hand will typically confirm the diagnosis of thumb CMC arthritis. Here's an example of a normal thumb CMC joint. Here is an example of a patient with early osteoarthritis of the thumb CMC joint. You can see that there are some very small osteophytes or bone spurs have appeared at the edges of the joint. Here's an example of advanced osteoarthritis with complete loss of the joint space and more significant osteophyte formation. X-ray findings do not always correlate with symptoms. Some patients with very mild X-ray changes may be very symptomatic, while patients with severe changes on X-ray may have little or no pain. We treat the patient based on their symptoms, not based on their radiographic findings. More advanced imaging, such as MRI, is typically not indicated for these patients. Now that you have diagnosed your patient with thumb CMC arthritis, what can you do to help? At this point, we do not have any therapy that can reverse osteoarthritis, but there are a number of non-operative and operative treatments that may help reduce the patient's symptoms. Several over-the-counter medications have been beneficial to some patients. Glucosamine chondroitin sulfate is a supplement that has been shown to be superior to placebo for the reduction of thumb CMC arthritis pain. This product is available at most pharmacies. Patients likely need to take it on a daily basis for at least 2 to 3 weeks to see a benefit. A topical cream called capsaicin cream can also be helpful. This contains the same component found in hot peppers. Application of the cream can provide immediate pain relief due to warming the joint. Over time, capsaicin cream can also have a cumulative effect by decreasing the amount of substance P in pain nerve fibers, which ultimately decreases the intensity of pain signals.
When I'm discussing these options with patients, I stress that not everyone responds to every treatment, but the options are both relatively low cost and low risk. Another treatment option is steroid injection. This is typically performed by a hand specialist. Like steroid injections for other arthritic joints, this does not slow the progression of arthritis or change the underlying problem, but it can provide symptom relief, sometimes for months. Steroid injections can be repeated at the discretion of the hand specialist.
Specialized hand therapists can also be an excellent resource for patients with thumb CMC arthritis. Like other arthritis treatments, hand therapy cannot reverse the underlying changes in the joint, but therapy can decrease symptoms and improve function. Hand therapy can provide support for damaged joints, maximize motion and strength, and provide information on joint protection and adaptive equipment.
Patients can benefit from a referral to hand therapy. Pain is usually the primary reason patients are seen for CMC arthritis. Hand therapy can provide support for damaged joints, maximize motion and strength, and provide information on joint protection and adaptive equipment. Most patients with CMC arthritis benefit from splinting support of the CMC joint. With the CMC supported, a patient can use the thumb for pinch and grasp with less pain. The type of splint depends upon the patient's need and degree of degeneration of the CMC and other involved joints. A hard plastic, custom fabricated orthotic provides the best support and can take into account various arthritic changes in the hand. The orthotic must support the CMC, maintain MCP and some flexion, allow IP motion, and position the thumb so it can be used for prehension. There are many prefabricated thumb splints on the market, but only a few specifically address the support of the CMC joint. The therapist can provide information on the appropriate prefabricated orthosis, such as the Comfort Cool CMC restrictive splint. Because this is a soft splint, most insurance companies will not cover it, but we can provide resources on where to purchase it. Patients may also be shown various taping methods that can provide support, biofeedback, and pain relief. Overall, different patients may use a variety of supports depending upon their activity and pain level. Pain relief options are discussed and can be trialed in therapy, including the use of heat from warm water soaks or paraffin baths. Contrast baths can also be used for both pain and swelling. Education on joint protection techniques is important to prevent excessive force on joints during activities. A therapist can help analyze the patient's activities and provide alternative methods or activity modification suggestions in order to reduce stress on joints during their painful or difficult tasks. Modifications might also include the use of adaptive equipment. Patients may be given an opportunity to try some adaptive scissors, larger handled utensils, or writing aids.
The thumb is most stable when the MCP is in about 20 degrees of flexion. Looking at the thumb laterally, you should see a nice even arch. Unfortunately, the surrounding ligaments often become too lax and cause the MCP to become either hyperextended or hyperflexed. Looking at the thumb dorsally, you should see the MCP lined up with the metacarpal bone and the proximal phalanx. Hopefully, it does not ulnarly deviate or radially deviate. These positions can lead to excessive pressure on the CMC joint. Therapists can instruct patients in exercises for neuromuscular re-education and strengthening of the thumb in order to restore and maintain the normal arch of the thumb during activity. The goal is to hopefully provide greater stability and reduce mechanical stress on the thumb, which will ultimately lead to less pain. Restoring the correct motion can be difficult to learn and incorporate for many patients. Therefore, patients are best served when they learn and practice the exercises under the guidance and skill of a therapist in order to verify they are completing the exercises correctly and they achieve the proper motion. Overall, therapy cannot reverse the damage done to joints, but if patients are referred earlier rather than later, the greater chances they will be able to benefit from a program of support, exercises, and joint protection in order to reduce pain and possibly slow the degeneration. And even if arthritis is in the later stages and your patient is considering surgery, a hand therapy referral can still be beneficial to provide them with resources and work on positioning prior to surgery.
When we can no longer control pain with non-operative treatments, hand surgery can be an excellent option for patients. The most common procedure performed by hand surgeons is called ligamentous reconstruction tendon interposition, LRTI, or thumb CMC arthroplasty. This procedure has been performed for more than 50 years with excellent results in most cases. There are many variations on the exact technique, but the basic components are excision of the trapezium bone and use of a tendon graft from elsewhere in the hand or wrist to stabilize the base of the thumb metacarpal. This surgery is typically done as an outpatient procedure and can be performed under general or regional anesthesia. After surgery, the patient is placed in a splint or cast for about 6 weeks. From 6 to 12 weeks, the patient usually wears a removable brace. During this time, they are also working with a hand therapist. Although the results in terms of pain relief and restoration of function are very good, it does take 3 to 4 months to recover from the procedure.
I did have a friend that drove me to the clinic for the procedure, and I was just so grateful for this surgery finally being scheduled, just to know that there would be relief. After surgery, after the cast was removed, started therapy with just really very elementary exercises. However, I think the trick for me was that I had to do them a number of times throughout the day. I just had to do it. It was part of the success of this surgery. And I was happy to know that I could always put a brace on, and I did wear that brace at night. I found that it was very helpful. When you're sleeping, you don't realize how you are twisting and contorting your body. And so the brace really protected my thumb. I used the little exercise soft ball to squeeze my hands, and I used the exercises for both hands, so I was really watching and monitoring the success of my flexibility and my strength and how I could just move my thumbs and to use my thumbs. And I started using my left hand more and more. And it was just kind of a gradual thing that I was almost like a unconscious movement again into having a normal life. And it was just absolutely wonderful.
In conclusion, thumb CMC arthritis is unfortunately a very common problem. Fortunately, as you have seen, we have many ways to help patients address their symptoms. Now that you know more about thumb CMC arthritis, we hope you can easily make the diagnosis in your clinic, offer your patients both operative and non-operative treatments, and be confident referring your patients to hand therapists or hand surgeons when necessary. Thank you for your time.